For nearly 7 decades, we've been advancing the mission to enhance well-being by exploring the relationship between spirituality and health. I'm Stuart Nelson. I'm the president and CEO here at the Institute for Spirituality and Health at the Texas Medical Center. The Institute was founded in 1955. At that time, our name was the Institute of Religion. And our very first program was the first nationally accredited hospital chaplaincy training program in the country. Over the course of our history, we have adapted and shifted our programs. Once hospitals started training their own chaplains, we began supporting those trainings through continuing education, working with all kinds of healthcare professionals. In the 80s, we founded a center on biomedical ethics with Baylor College of Medicine and Rice University, and actually Baylor's current ethics department has its roots in that collaboration. In the 90s, we started doing more conferences and continuing education for all kinds of healthcare professionals, including mental health professionals and nurses. And most recently, over the last 10 or 15 years, we've really begun focusing on our 4 centers of excellence. The Institute for Spirituality and Health's 4 centers of excellence are the Center for End of Life and Aging, the Rabbi Karff Center for Healthcare Professionals, our Center for Body, Spirit, and Mind, and our Center for Faith and Public Health. The Institute Center for End of Life and Aging focuses on spiritual dynamics that occur through the life course and at the end of life. The core program of the Center for End of Life and Aging is called the Interfaith Spiritual Care Coalition. And this coalition trains volunteers to go into healthcare facilities, long-term care facilities, nursing homes, and similar facilities in order to provide a spiritual supportive presence for people that might be feeling isolated, don't have family visiting them, don't have faith leaders visiting them. So it's a really special way to provide that kind of support at the end of life. The Institute for Spirituality and Health's Rabbi Karff Center for Healthcare Professionals engages students in the health professions in a wide range of programs and internship opportunities and conference opportunities that help prepare them for a lifetime of professional practice, keeping spirituality and health in mind. The Institute for Spirituality and Health's Center for Faith and Public Health is a really exciting area of work where we bridge public health systems and faith communities. For many people, faith communities are their first stop on their health journey. They ask questions to health ministry leaders, their pastors, other faith leaders, and fellow community members. And sometimes those communities are receptive to and prepared to answer those questions, and other times they're not. So we really help faith communities be empowered to tackle health issues where they are. The Institute for Spirituality and Health's Center for Body, Spirit, and Mind focuses on the range of practices that link body, spirit, and mind. So some of those practices include meditation practices, contemplative practices from across traditions, different movement and creative practices, all with an evidence base to show that they impact mental, spiritual, and physical health. Our anchor program in this center is the Greater Houston Healing Collaborative. The Greater Houston Healing Collaborative began as a response to Hurricane Harvey and the psychosocial trauma response that needed to take place in the wake of that disaster. We trained 120 individuals from different sectors in mind-body skills through a curriculum established by the Center for Mind-Body Medicine in Washington, D.C. And since then, those trained have gone on to lead workshops and groups that have reached tens of thousands of people in this region and beyond, empowering them with skills that they can use to mediate the stress response and overcome post-traumatic stress, anxiety, depression, and isolation. One of the things that sets the Institute for Spirituality and Health apart from other similar organizations is that we're not attached to a university system, we're not attached to a particular health system, and we're not part of a particular religious tradition. We are open to all. So that means that we work with people who are close adherents to their religious traditions, and then also spiritual seekers who might not, practice within the context of a community. And people who come through our doors find value in what we do, kind of no matter what they believe in and where they come from, because of that unique, open view that we have of the people that we work with.